Welcome to Savitha Dental College Lecturecast, Department of Orthodontics. The topic for discussion is classification of malocclusion. Why is classification required? Classification is grouping of cases which are similar in appearance and comparison and handling and discussion. When a patient enters your clinic first, there will be a questionnaire interview and clinically examining the patient and analysis of his records, creating a database for the same patient and classifying the patient according to one group and forming a problem list for the patient and diagnosing and formulating a treatment plan for the same patient. Classification is needed for ease of reference, comparison of your results and communication. There are various classification systems that is available for us. Angles classification is one of the pioneer systems of classification. It is again classified into Class 1, Class 2 and Class 3. The Class 2 is again classified into Division 1 and Division 2. Angles Class 1 is the mesiobuccal cusp of the upper first molar falls on the buccal groove of the lower first molar. It can be associated with the crowding of the anteriors, deep bite, cross bite, open bite. Angles Class 2. The distobuccal cusp of the upper first molar falls on the buccal groove of the lower first molar. Angles Class 2 Division 1. There is a Class 2 molar relationship with proclined upper anteriors with increased overjet. Angles Class 2 Division 2. The upper central incisors are retroclined, upper lateral incisors are proclined. There is a complete deep bite with a Class 2 molar relationship. Angles Class 3 Malocclusion. The mesiobuccal cusp of the upper first molar falls between the interdental space of lower first and the second molar. Disadvantages of angles classification. Only anteroposterior relationship has been considered. The first permanent molars are considered as fixed points. Cannot be applied to if the first permanent molar is missing. Cannot be applied for deciduous dentition. There is no differentiation between the skeletal and dental malocclusion. Angles classification modified by Dewey. Angles class 1 malocclusion has 5 types. That is type 1 crowded anterior teeth. Type 2 is protrusive maxillary incisors. Type 3 is anterior crossbite. Type 4 is posterior crossbite. Type 5 is mesial drifting of the permanent molars. Modification of class 3. Type 1 edge-to-edge incisor relationship. Type 2 is crowding and lingual relationship of mandibular incisor to the maxillary incisors. Type 3 is crowding and crossbite of relationship of maxillary incisors. Litzer's modification of angle system. Neutro-occlusion, angles class 1. Disto-occlusion, angles class 2. Mesio-occlusion, angles class 3. He has also added the suffix version of buccoversion, lingoversion, supraversion, infraversion. Mesioversion, distoversion, torsiversion and transversion. Simon's classification consists of 3 planes as Frankfurt's plane, orbital plane and sagittal plane. Malocclusion away from the Frankfurt plane is abstraction, closer to the Frankfurt plane is attraction. Away from the orbital plane is protraction, closer to the orbital plane is retraction. Away from the sagittal plane is distraction, closer to the sagittal plane is contraction. Ackermann-Profit classification. It consists of 3 circles which is enclosed within a bigger circle and the whole thing is enclosed within a box. The first circle consists of the transverse deviations, that is buccal, palatal, unilateral, bilateral. It can be skeletal or dental. The second circle consists of the sagittal deviations, that is angles class 1, class 2, division 1, division 2, class 3. The third circle consists of the vertical deviation, that is open bite, anterior or posterior, deep bite and collapsed bite. The 3 circles are enclosed into a bigger circle which represents the profile of the patient. The 4 circles again is enclosed within a box which represents the interarch symmetry. Skeletal classification given by Salzman. It is again divided into class 1, class 2 and class 3. Skeletal class 1 is orthognathic maxilla, orthognathic mandible with straight profile and competent lips. Skeletal class 2 is prognathic maxilla, retrognathic mandible, convex profile and incompetent lips. Skeletal class 3 is retrognathic maxilla, prognathic mandible with concave profile. With this, we come to the end of this classification of malocclusion. Thank you.